You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast. I am so thrilled to have you here today. Today is actually my birthday. Yes, the 18th of August, and I am another year older. So I thought in this episode, I'd talk about a few different topics, things that have been coming up recently, and things that I just want to share with you that maybe I haven't quite touched on so far. So thank you very much for joining me. This is the place where I share my 30 years of dental experience, having graduated in 1992. And it's my mission to empower people to have healthy smiles for healthy lives and to understand how their dental health impacts on their overall health and vice versa. So let's get to it. This is the birthday show of the Dental Zone. Let's get in the zone. Hello, I'm Dr. Rachel. I'm a holistic dentist at Evolve Dental in Brisbane, Australia. Thanks for joining, and today I'm going to talk about the importance of brushing your teeth. And I'm going to call this Brush or Die, Dental Health and Early Death. Now that might seem a bit extreme, but let me explain more. Adult tooth loss is linked to early death. Brushing your teeth, it's not just about fresh breath, cavity prevention, or having a gorgeous smile. Brushing your teeth keeps your mouth healthy and it reduces your risk of tooth loss. And following a recent study in the Journal of Periodontology, which is about gum health, it's even more important than ever before to keep your teeth for life. Because the number of teeth we lose is a key indicator of a person's life expectancy. And researchers have found clear evidence that tooth loss is related to some life-threatening health problems. So there's many factors such as stress, socioeconomic status, oral hygiene practices, smoking, trauma, chronic disease, genetic conditions, nutrition, and lifestyle choices that are going to contribute to your risk for tooth loss. Physical stress and poor health often show up early in the mouth. What are your teeth telling you? What are they saying? People who have lost 5 teeth or more by the age of 65 have a heightened risk of early death. People with missing teeth were more likely to suffer from serious health issues, such as cardiovascular disease, diabetes, and osteoporosis. And this is fascinating. If you still have a full set of teeth by the time you're 74, you are more likely to live to 100 years old. Go figure. There are many reasons why we lose our teeth. Trauma, smoking, poor oral health. Tooth loss can be an indication of a person's poor quality of life, which means there's a higher likelihood of gum disease and other health issues that will contribute to an increased risk of life-threatening conditions. So what's going on in our mouths? This is a really useful window to our overall health. It is therefore vital that we take proper care of our teeth and gums and pay close attention to what's happening, as it could be a sign of something more serious. Can brushing your teeth improve your health? A group of scientists in the US conducted a trial to see if using a special toothpaste which stained any remaining plaque bacteria that hadn't been removed from the teeth, if it hadn't been brushed away properly, it showed up. They wanted to see if this could improve people's heart health. Now, the toothpaste was found to both reduce dental plaque and inflammation through the body. Now, inflammation levels are accurately measured by measuring C-reactive protein, and this is a marker for cardiovascular disease, which may result in a fatal heart attack or stroke. People using the special toothpaste were able to remove twice as much plaque and bacteria while reducing their levels of inflammation by 29%. That's amazing. Previous studies have shown that people with infected gums are more likely to suffer from cardiovascular diseases, but it had never been shown that good dental health could lower the risk, and this previous study in the US showed that. So improve oral health and add years to your life. It's all about filling your years, not your teeth. If you want to add years to your life and prevent issues with eating or communicating, it's important to keep those teeth and gums as healthy as you possibly can. I'm always sharing my message and urging people to take better care of their mouth, visit their dentist regularly, and brush and floss. So cut down on the sugary foods, cut down on the sugary drinks, brush and floss twice a day, use an alcohol-free mouthwash or oil pulling, and use it as part of your dental care. See what changes you can make in your lifestyle and your diet to support better health, reduce inflammation in your body, and expand your lifespan. If you experience blood in the sink after flossing or brushing, your gums appear swollen, your teeth have moved, they've drifted or feel loose, or it's been more than 6 months since your last dental visit, then please book your dental check today. It might just save your life. So the next time you don't feel like brushing or flossing and you're coming up with all those excuses and justifications and I'll do it tomorrow's, remember it's not just about brushing the food and plaque off your teeth and having fresh breath. It is about helping you to have great systemic and overall health and well-being. So I'm going to cover a few topics today in this episode of the Dental Zone, and I feel that it'd be really relevant and poignant to talk about sugar and sugar consumption after we've just talked about the importance of brushing well and reducing the amount of plaque and bacteria on your teeth and gums and in your mouth. Today I'm going to share 8 tips to cut down on sugar. So of course, being a dentist, sugar is a big issue. We all know sugar causes dental decay, but it also causes issues with your health. So are you eating too much sugar? These are going to be my tips to reduce your sugar intake. I'm a holistic dentist. I'm going to share how to cut down on your sugar for the benefit of your teeth and your health. Sugar really isn't good news for your dental health. We all know it causes tooth decay. Frequent sugary attacks on your teeth cause rapid tooth decay, and that's going to lead to cavities and pain. It's going to increase the likelihood that you're going to need fillings and other dental treatment. Your sweet tooth can end up costing you greatly in terms of dental treatment, not to mention the list of other negative consequences. Overconsumption of sugar is just not good news. An excess of sugar puts a strain on your liver. It increases fatty acids in your blood, which may be stored as fat, and it increases the chances of a number of metabolic diseases such as diabetes and heart disease. Not to mention, it impacts on your sleep, your concentration, and your energy levels. The problem with sugar is that it's not easy to moderate. It's highly addictive. It's addictive as cocaine. I'm going to offer my tips now. I'm going to talk to you about cutting back on sugar without feeling like the joy has been sucked out of life, that you can't eat anything. And we're going to address some of the challenges that it comes to making a long-term lifestyle change. So what are these 8 tips? Number 1, look at drinks first, because drinking sugar is often a habit rather than a necessity. Your sugar in tea and coffee, for example, fruit juices at lunchtime, or a soft drink when socializing. If going without is particularly tough at first, look to cut down the amount of sugar gradually and allow a natural shift in your taste buds and your preference for it. Half a teaspoon of sugar instead of 1 in your tea, or use a smaller juice glass in the morning. Number 2, find lower sugar substitutes for your favorite foods. Quite often there can be a big difference in the sugar content between brands of the same food. Spend a little time researching and finding the ones that don't have as much sugar added. This can shave off a few grams here and there that can make a difference if you're eating these products daily. Number 3, be mindful of your total sugar, especially your fructose. Although fruits and natural sources of sugar have a nutritional benefit and are healthy in many respects, they are still sweet, and you're still likely to experience a powerful craving when you're excessively consuming them. Fructose, which is found in refined sugar and in fruit sources, is the more addictive part of sugar, the part that we desire the most. To start managing your cravings, be mindful of the total amount of sweet food in your diet, including your fruit, the quantities that you're consuming, and how often you're eating it. Number 4, avoid hidden sugar. It goes without saying, avoid sugar that you don't know you're eating is hard. Double check the sauces, the dressings, the cereals, soups, etc. Look to make your own where you can and cut back on processed foods as much as possible. Number 5, do one thing at a time. When you first start looking to cut back on your sugar and you realize you're eating a lot of it, the whole prospect can be just somewhat depressing and overwhelming. So start by making one change at a time. Small changes over time are more sustainable than trying to do a drastic all or nothing cold turkey approach. 6, consider your use of sugar. It's very common for people to use sugar as a stress coping mechanism. It's accessible, it's cheap, it's quick, and it's easy. Take note if you're eating sugar in response to emotional hunger. Seek to build in other coping mechanisms that don't involve sweet food, like meditation or something relaxing like a walk or a simple breathing exercise. 7, embrace the savoury foods you love. To avoid the doom and gloom and feeling of eating less sugar, embrace your favourite savoury foods in all their forms. Try new combinations of them. Be more experimental with foods and try to enjoy the process of finding savoury alternatives that you really get excited about. Watch your salt content though. Number 8, work through social challenges. Often it's the social side of sugar that we need to be particularly aware of. It's quite challenging, like birthdays, weddings, and numerous annual occasions that are closely associated with excessively sugary food, cakes and biscuits. Seek to understand if you're eating sugar because everyone else is, or if it's closely tied to the joy you feel at these events and celebrations. Building awareness of your sugar habits in social situations is the first best step to adjusting them. I hope you found these tips helpful and you can see that there is a way to monitor your sugar intake, to be more aware of where those sugars are coming from and how to reduce them down, if not quit them altogether. In this episode of The Dental Zone, I'm just going to cover one more topic because these are things that are on my mind because my patients ask me these a lot and we get these questions on our social media as well. So I'm going to move on to talk about the reasons why you might be experiencing tooth sensitivity and discomfort when you have cold, hot, sweet or acidic things. 5 common reasons why your teeth are sensitive and what you can do to make it better. Now, sensitive teeth can cause discomfort, but you don't have to put up with them forever. There are things you can do. Does eating ice cream, drinking cold water, or brushing your teeth make you wince? Does it make you painful? If you answered yes to this question, you may have sensitive teeth. The good news is that you don't have to deal with this and this discomfort forever. If you figure out why your teeth are sensitive in the first place, you can solve the problem and take the steps. So here are 5 reasons, other than having a hole or a cavity, as to why your teeth may be sensitive. Number 1, you brush your teeth with too much force. Brushing your teeth with a lot of force might seem like, yeah, that's going to be the best way to get all the plaque and food off, but it can actually do more harm than good. When you brush your teeth too aggressively, too hard, you wear down the protective enamel and expose the inside of the tooth. You can also cause trauma to the gums, creating gum recession and more sensitivity. So swap over to a soft brush and scrub your teeth more gently. Take your time. Number 2, you've just had a dental filling. It isn't uncommon to experience tooth sensitivity after getting a tooth drilled and filled. When your tooth is exposed to cold air or sweet foods, you may feel some discomfort. I can assure you that sensitivity will normally diminish within a week or 2. And if it doesn't, then you need to get back in touch with the dentist. The filling might just need a little adjustment. Number 3, you use mouthwash too often. Yes, it's true. Now, mouthwash will remove bacteria from your mouth and it will lower your risk of gum disease, which is a great thing. But if you use it too often, it can make your teeth sensitive, particularly if there's alcohol and other chemicals in the mouthwash, because that can make your teeth more sensitive. If you don't want to stop using your mouthwash, choose a neutral rinse that's pH neutral and doesn't contain alcohol. 4, you're eating too many acidic foods. If you eat acidic foods like oranges, tomatoes, pickles, and you're doing that on a regular basis, you're more likely to have sensitive teeth. These type of foods can erode your enamel and make it thinner, and it leaves the dent in the inside of the tooth exposed. And if you don't want to give up your acidic foods, at least eat some nuts or rinse your mouth with water afterwards. This way you're going to neutralize the acids in your mouth and give you a chance for your enamel to recover. Number 5, you grind your teeth. Tooth grinding can make your teeth really sensitive. When you clench down on your teeth, the enamel will slowly wear away over time, uncovering the tooth nerves. Teeth clenching also bruises the support structures and the nerve supply that go up inside the tooth, making it more tender and hyperreactive to cold and pressure, hence more sensitive. So a nighttime appliance, a bit like a special anti-teeth grinding mouthguard, that can prevent you from grinding and damaging your teeth. If your teeth are still experiencing sensitivity, even after you've made several lifestyle changes, you need to contact your dentist for an evaluation, as you may have a cavity, a leaking filling, or a crack inside your tooth. And if it's been 6 months or more since your last dental check, then contact us on 07 37 20 1811 and book in for a comprehensive mouth evaluation where we can check things over for you and make sure that there are no issues. And if you are having sensitivity, point you in the right direction. Thank you so much for joining me in this birthday edition of the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. You can find out more by hopping on over to holisticdentistry.au. And if you do want to reach out, then our phone number for booking appointments, as I said earlier, is 0737 201811, or you can email info@holisticdentistry.au. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.